So we now have, let's do about 5 minutes for questions and for the panelists. Could the 4 speakers come up and our 2 moderators from this session? This is fantastic. Is this available online? Excellent. No, I understand. That's okay.
Yes, I think Dr. Khaled has a question already.
If everyone could please use the microphone, because this is being recorded, and if you don't speak into the microphone, you won't be heard.
I would like to...
And if you could identify yourself, please.
Hussein Khaled, Cairo, Egypt. I would like to congratulate the 4 speakers for their outstanding presentations. My question is to Dr. Torres about the guidelines, because we have exactly a similar experience in Egypt, but you spent 1 year in doing these guidelines, and finally you published this. What do you think that these guidelines are changeable? So how can you succeed in maintaining the updating of these guidelines? Because we had this problem in Egypt. And number 2, did you take care of the budget limits for these guidelines? Because you may or may not use some of the agents based on the allocated money budgeted by the Ministry of Health for or the insurance for these guidelines.
The Chilean Society of Breast Diseases has planned to review every 2 or 3 years the guidelines. Things change very quickly, but the proven treatments which are that have the evidence-based, the evidence the evidence behind the recommendations don't change that rapidly. So we think that every 2 or 3 years of reviewing it, it's okay. And about regarding the funding, you mean? The second question is about the funding. The society had some funds that historically we have been accumulating, so we used some of that money, and also we had an important help from the industry.
No, I mean there is restrictions on the guidelines based on.
Oh.
For example, did you add the Herceptin?
Like Herceptin, or like MRI, or like the use of MRI. I mean, it's expensive, or the use of Herceptin. That's what you mean. Yes. Well, we try to define in a very accurate way which patients need really Herceptin, for example. The recommendation was written in a very precise way, and also the Ministry of Health that took the guidelines, they define the specific group of patients that need, in whom this indication was needed, and the government define some amount of money, a total amount of money that should be spent in the patients that needed Herceptin.
Okay, yes, Dr. Harford.
Yeah, my question had to do with Uruguay. It was very impressive that you achieved this complete coverage with medical oncology in all the states of your country, including away from the yellow dots where I presume the major cancer centers are, because that's where the radiotherapy is. And my question is, were there any incentives other than a free market, let everyone practice medicine where they want to? Were there any incentives to achieve that coverage of Uruguay in your system?
Thanks for your question. And the problem is that in 1985 was created the academic area, the oncology career in medical oncology in our country. Dr. Ignacio Muset was the professor, the first professor for 20 years, and we ran an academic global institution and training for all these people, and all the people who were trying or would like to stay in different parts of the region had to come before to the academic area in Montevideo at the University Clínicas Hospital, the only academic university hospital at that time. So they make their career, they graduated in medical oncology all over the 20 years, and they came back to their region where they were originated there, in 19 different regions in our country. So it was only the academic, there was no extra condition. It's only the academic area. They had to train, they had to receive the medical oncologist trainee in order to come back to their places and to train and to be the doctor. Yes, there are some poor. But the main reason in our country, and I think one of the easiest way, was that the academic area, the university, is in Montevideo. It's very well centralized, so everybody could go there, stay for 4 or 5 years, usually our career, and then they graduated in medical oncology, and they come back to their place in the country.
Okay, thank you. I think Dr. Nagir first, Nagi El Sagir first. You put your hand up first, yes.
Thank you. Naji El Sagir from Beirut, Lebanon. As you know, at the Breast Health Global Initiative, we are very interested in the implementation of guidelines. Now, you went through all this process. You have all the guidelines. How do you plan to disseminate them, to implement them, not only in academic hospitals, maybe in smaller hospitals, in private clinics, and do you have any plans to measure the implementation, the change in outcome, etc.?
In Chile, the diagnosis and treatment of breast cancer should be done according to the guideline, and that's part of a law. And there's financing for that purpose. I don't know if I answer your question. In law. By the law. These are...
I think one of the question that I think the audience is getting at is that you had a very difficult situation, and I was really impressed at your process. By the way, I think that the guidelines that they have that are available online, there's nothing about it that's really specific to Chile. I think any Latin American country would find the material in here applicable. But what they're getting at is, okay, so you got the government to say, yes, we'll pay for that, but now what happens if they run out of money? Are they really going to pay for this? Or what's going to happen in practical terms when there are real financial constraints, and many of these things are very expensive?
Until now, that hasn't happened. We have had the budget to finance all the medical attention that's needed for breast cancer diagnosis and treatment. We have not been in that situation. I mean, the law establishes that this disease, breast cancer, is one of the diseases that should be diagnosed and treated the way the guidelines establish, and that's written in the law. So that must be achieved. And the national budget is destinating enough money for that purpose every year. I don't... The quality control is not assured yet, but it should be assured in 2 or 3 more years, also established by the law.
There will be presentations later today that will deal with that very question, that the